is, hi everybody, my name is Cynthia and I'm the nurse injector here at San Antonio Cosmetic Surgery Center. Today we're going to be doing a live Voluma injection for my great patient here, Tracy. I have marked her face already, as you can see, with these landmarks of where I want to give her fullness to her face. She's 37 years old. She has some nice cheekbones, but we've got a little bit of flatness here right down the middle. So I'm going to add a little bit of Voluma in these areas where I've X'd off. My grid is areas where I'm going to stay away from. It'll take me a few minutes to inject. I'm going to wipe, inject, and just try to see the transition we go by building up this little bit more of a youthful cheek for her, okay? All right. She's been numbing for about, I would say, 20 minutes. She did really well. I still like to use a topical spray just to kind of help her out. So she's doing great. There we go. Just gonna feel a little bit of a pinch. And how are you doing?
Okay.
She's a great patient. I can't complain. And I slowly inject. I just want to see the product give us a little bit of fullness for her. Like I said, she has a youthful look already. I just want to pop it up a little bit for her and give us that little bit of a challenge. Sometimes we start to lose a little bit of a fat in this area, in the mid-face, so we look a little flat. I just want to, like I said, again, just give her a little bit more of a pop in that area. Give her some round cheeks again. And here we go. See, she's doing really well. Not complaining at all. Voluma is a product that will stay in for about 2 years. I use possibly about 2 to 3 syringes per patient. That's a nice amount. That'll give her a nice result. Some patients will come back and add a little bit more just because they really like the volume it gives them in this area to make them look a little bit more youthful. Very little bleeding with this, as you can see. And she's tolerating extremely well. You okay?
Yes, ma'am.
All right. So again, go in. I inject, and I can already see a little bit of fullness coming out for her and just giving me a nice transition, a change for her. That is not too dramatic, but nowadays we have a lot of girls that are using their makeups to highlight. You know, we're using the highlighters and the brighteners, you know, they're contouring with spoons, and that's all great, but for some patients that's a lot of work. The Voluma gives them that natural kind of pop, gives them a little bit more of a transition where they're just happy all the way around. And again, it lasts for 2 years. We use about 2 syringes, sometimes 3. And see, we have our special for this month is going to be $200 off our Voluma product. All of our fillers, the Juvederm, I do a lot of lips also, so you can take advantage of the special and use it on your lips also. If you have any questions, please feel free to chime in. The spray is just for numbing. Again, she's numb already with my cream. Look straight ahead. This is just an added bonus. I like to spoil my patients, make sure they don't feel anything ever. And as you can see, she's not screaming. She's sitting there patiently, doing very well. How you doing, Tracy?
Awesome.
Okay. So I've done 1 syringe on this side. You can really see a nice difference for her, how I've just done a nice transition in her mid-face to her cheek. Again, these are subtle changes, nothing that's going to make you look distorted, scary, robotic. Everything is just a subtle change. A little bit of bleeding is normal. Nothing that makeup wouldn't be able to cover it this evening. Nothing that actually would be of an issue for her. The only thing I require is that she doesn't work out tonight. Again, this month we'll have a special. It is $200 off of our Voluma, $200 off of a Juvederm, so we can use Juvederm, lips, nasolabial folds, Voluma, mid-face. 2 years for the mid-face. Juvederm's going to last you between 9 to 12 months. We're also going to have, for all of you that are watching our live stream right now, we're going to have one winner of one free Voluma syringe. So all of you ladies that are interested, and men, because I do a lot of men, please, please, please chime in. Your like on our Facebook will get you qualified. And let's see who gets the actual syringe. I'm going to go around and work on the other side. All right. As you can see, that smooth, nice little round cheek now, it really gives her a softness where she had a little bit of flatness right in there. Now I'm going to the other side. Got my marks here where I've decided she actually needs a little bit of fullness. Sorry, sweetheart. Again, I'm using my spray just for topical, just to kind of take the edge off. A little cold, but she tolerates well. All right, here we go. Look straight ahead. Again, most of us women, we start to lose the fat here in our mid-face. When you wear your sunglasses, sometimes you see a little bit of an indentation, and that's how I get my patients coming in going, what is these indentations on my lower lids? It's a little bit of the fat loss we have. So we just create it with the Voluma. Now I'm gonna, again, I crossed off another area right at this section. These are my points, my 3 points where I feel if I project in here, we'll pick her up a little bit and give her a little bit more of a nice apple cheek look. You can come in to see me. I'd be more than happy to talk to you. There's no charge for the consultation this month. We can just sit down, talk, take some pictures, address some of your concerns, and then I'll give you a quote, what it would cost you, how many you would need. We could make a game plan of, you know, some patients will come to me and say, oh, I don't want to use all 3. Can we just use one? And I said, yes, but you'll come back. And usually 9 out of 10, they'll have one. They get to the waiting room, go to their cars, look in the rearview mirror and go, wow, this looks really nice. No, I need that second one, maybe in the third one. And that's okay. It's just getting used to the change. She's doing really well. How are you feeling?
I'm doing good.
She's a great patient, wonderful candidate for this procedure. First time ever. So I like the fact that she's so relaxed and she allows me to talk over her and just give her this really, really nice, soft look. Thank you so much. Now again, this is a nice, subtle change for her. Nothing too dramatic. Something that's just going to give her a nice little pop. So next time she's putting on her makeup, she might not use the highlighter as much because this will bring out her nice cheekbones again, give her a fullness right down the middle. Help her with a pop. I'm going to go back in here where I kind of see my light hits her face. I want some reflection on there. Questions, comments, please, I'm here. Feel free. It's perfect timing for all of you that are out there that have always thought about this, but we're too scared. It's a perfect timing. Any questions and comments will qualify you for a free syringe. See? Very little bleeding. Rarely do my patients ever get bruising unless you're on aspirin or any blood thinning products. She's gonna love this even more tonight when she leaves here and she wants to go out. And you can go out, have dinner, put your makeup on. She'll love when her makeup goes on and just highlight these areas. That's when my patients are the happiest in the evening. If I call them and say, hey, how are you doing? How did you do? What did people say? They're like, oh my God, my cheeks look so pretty and I like the way my makeup goes on. It really, really just kind of highlights. And all I ask our patients is definitely no exercising tonight, no laying flat for the next 4 hours, stay away from the makeup for about an hour after the procedure. Other than that, I follow up with you 10 days, make sure everything's okay. If we need to add more, if patients want to add a little bit more product, we can. Perfect. You can also, remember, when you do these procedures, we can combine them. We could do mid-face, Voluma, Juvederm, a little bit of Botox. All these things can be in combinations. Patients tolerate this very well. It's easy to do. It takes maybe half an hour to 45 minutes to combine. Right now, obviously, I'm doing a live stream, but usually I like to take my time with my patients. Before I started with her, I took plenty of pictures. Her and I sat down and compared what I was looking at and what she was looking at, the deficiencies in her face. Then I went ahead and I numbed her. After I numbed her, then I went ahead and I marked her. And she asked, why are you marking me? I said, look, these are the areas that I feel you're lacking in. We want a little bit more volume. I X'd off. She's like, wow, I never even thought about this. So now we're able to talk a little bit. I want to see if she's fuller on one side versus the other side. So again, we do a lot of consultation. I take my time with my patients to just make them feel comfortable. Again, any questions you may have, please feel free to call. Again, our special is going to be $200 off the Voluma, which will make it $650, and then $200 off of Juvederm, which will make it $425 for our Juvederm syringe. We've got all the comments and questions are going to be picked for a random free Voluma syringe, so keep them coming. Questions, again, I'm more than happy. Comments. This month, please like us on our Facebook page. Our entire staff here is going to be ready, waiting for your questions, making an appointment at San Antonio Cosmetic Surgery Center. Sachs, Dr. Baumholz and Dr. Ortegon are fabulous plastic surgeons here in our practice. They're both seeing consultations Monday through Friday. Any questions, we do all other surgical procedures with our doctors. Anything we can answer for you, our complete staff here. We have Nadia, Terry, Jennifer up front, Elizabeth that can help you with any questions. We've got our wonderful Tracy here that does all our insurance billing, Monica and Nicole, our medical assistants that will guide you through the process. And I think Dr. Baumholz is in the room here. I'm just going to come in and say hello. I'm done with my patient, board certified plastic surgeon. He's not on vacation. He's here with me today, just having a blast with our live stream.
We'll say hi to Dr. Ortegon.
Yes, Dr. Ortegon. I hope you're enjoying your vacation. We miss you.
We're still doing okay?
Yes, we're still here. Doors open.
We've been doing this.
Probably I've been injecting for 9 years. I've been doing plastic surgery for about 25 years.
Awesome.
Yes, I'm old.
And injections is the...
Yeah, I really enjoy doing lips. Voluma is an amazing product I love to use when patients are not ready for their face. The Voluma has come in very nicely to enhance my patients.
Awesome.
Wow.
Well,
She did great.
It was fun watching the video. You did a great job. You did a great job, too.
So we'll see you next Wednesday again.
Bye from
We'll have
Saks.
something different to show you. All right? Have a nice afternoon. Again, like us on Facebook. Thanks to Jen, our practice manager, that did all this work, got this together for us. Goodbye.
Bye.